Hi everyone, my name is Rohan Kapoor, PG resident, Department of Radiodiagnosis, MMIMSR, Mulana, Haryana. I'll be presenting a paper on the topic ultrasound findings in patients of thyroiditis. Thyroiditis includes an array of clinical entities affecting the thyroid gland. On grounds of etiopathogenesis and clinical findings, 8 diseases present with thyroiditis picture: Hashimoto's thyroiditis, subacute lymphocytic thyroiditis, subacute granulomatous thyroiditis, postpartum thyroiditis, Riedel's thyroiditis, infectious, toxic, and actinic thyroiditis. Aims and objectives. The aim of this study was to evaluate sonographic features of thyroid gland in patients of thyroiditis. Materials and methods. The study was a cross-sectional observational study conducted at Department of Radiodiagnosis, MMI, MSR, Mulana, Haryana from January to September 2024. Scans were performed using Philips ultrasound machine in the Department of Radiodiagnosis. Results. In our study, a total of 38 patients were included and a vast majority of patients were female, that is 36. Ultrasound analysis showed heterogeneous ecotexture and hypoechogenicity in 37 of the 38 patients. All the patients presented with alterations compatible with thyroiditis on laboratory tests. Hashimoto's thyroiditis and hypothyroidism. Hypothyroidism is a condition that results from underproduction of thyroid hormones. Hashimoto's is an autoimmune disease which is the most common cause of hypothyroidism in the United States. In Hashimoto's disease, the thyroid becomes inflamed, and as a result, the thyroid produces smaller amounts of thyroid hormones. In order to compensate, the pituitary gland releases more TSH, which causes the thyroid to become enlarged. Clinically, many patients are asymptomatic in the early stages of the disease. However, as the disease progresses, they may present with puffiness under the eyes, puffy face, dry skin, slight weight gain, depression, increased cold sensitivity, and elevated blood cholesterol levels. The end stage of this disease may actually lead to fibrosis and atrophy of the gland. Sonographically, the thyroid will appear diffusely heterogeneous, coarse, and mildly enlarged with increased vascularity within the gland. Oftentimes, multiple, ill-defined hypoechoic regions separated by fibrous hyperechoic tissue will be demonstrated in Hashimoto's thyroiditis. In this patient, Hashimoto's thyroiditis, we can see an enlarged and diffusely hypoechoic gland. Pseudonodular appearance is one of the ultrasound features that is highly suggestive of Hashimoto's thyroiditis. It shows multiple hyperechoic nodular appearances consistent with fibrosis. The hypoechoic areas consist of lymphocytic infiltrates. These are the nodular appearances consistent with fibrosis, accompanied by the hypoechoic areas which consist of lymphocytic infiltrates. This pattern is also known as the giraffe pattern. Here we can see the pseudonodular appearance of thyroid gland consistent with Hashimoto's thyroiditis. The most commonly described sonographic appearance in de Quervain's thyroiditis is poorly defined regions of decreased echogenicity with decreased vascularity in the affected areas. These can be bilateral or unilateral. The thyroid gland size is mostly normal but can occasionally be enlarged or smaller in size. Longitudinal image of various patients here demonstrates two poorly defined two poorly defined hypoechoic areas within the thyroid gland. De Quervain's thyroiditis clearly shows hypoechogenic areas with poorly defined contours, especially in subcapsular location. Here is a case of acute bacterial suppurative thyroiditis with abscess in the left thyroid lobe. Ultrasonography is useful for evaluating the thyroid gland in conjunction with the laboratory tests like thyroid profile. Hashimoto's thyroiditis is the most frequent cause of permanent hypothyroidism in areas with adequate iodine intake. Subacute lymphocytic thyroiditis is also an autoimmune painless disease with transient thyrotoxicosis and lymphocytic infiltrates similar to Hashimoto's disease. Postpartum thyroiditis is also an autoimmune process that may occur in first year of delivery, most frequently between second and fourth month. Riedl's thyroiditis is a rare chronic form of thyroiditis where fibrous tissue replaces the normal thyroid tissue, causing hardening and diffuse destruction of thyroid gland and tending to extend to the adjacent tissues. As we come to the conclusion, one may conclude that ultrasound findings of gland heterogeneity and hypoechogenicity associated with cervical lymph nodes are extremely useful in the diagnosis of thyroiditis when correlated with laboratory and clinical tests. And these are my references.